Good morning, everyone. Hello, hello, hello. Welcome to day 3 of Heritage Bank's five-day virtual seminar in commemoration of the International Women's Day. Today is the third day, and it's been an amazing first 2 days. On day 1, we talked about finances with Mrs. Afola Shade Alonge talking to us about how to plan for the future financially as a woman. Talked about personal budgeting, planning your priorities, and different financial products we could subscribe to. And then yesterday was an amazing session with Mrs. Mary Akpobome talking about striking the balance as a woman in the different roles that you play in your life. So sister, wife, daughter, sibling, how do we strike the balance? And I know that for us, one of the key takeaways was how you need to prioritize yourself and make like a very big space for you as a woman to take care of yourself before you can then fulfill your other roles in your life. If not, you burn out. So that was an amazing session yesterday. Today we'll be talking about health, which is priority. And the person who will be speaking to us today is Dr. Obehi Aimiosor. She'll be speaking to us today about what women need to know about their reproductive health. You know, as women would give birth, would have our normal menstrual period. So it's important that we get information and knowledge on how best to navigate this season. So I'll be reading Dr. Obehi's profile, right? And then I'll welcome her in. Please note that you can watch the videos for day 1 and 2 on our YouTube channels, and also this video for day 3 will be uploaded, and then we have day 4 and 5, and day 5 is the grand finale. So I'll go straight into Dr. Obehi's bio. Dr. Obehi Aimiosor obtained a degree in medicine and surgery from the University of Ibadan College of Medicine and has demonstrated history of working in clinical medicine, public health, research, and health financing. She's also a Sustainable Development Goals advocate with a focus on SDG 3, which is about good health and well-being. She's currently the Vice Lead Health for the New Child Initiative, a non-profit organization that promotes child health awareness and sustainable education to empower Nigerian children. Her job focuses on helping children in underserved communities have access to education and essential healthcare services through health outreaches, awareness campaigns, and school health programs. Dr. Obehi is a member of the Health Literacy Leadership Program at the West African Academy of Public Health and works full-time as a quality medical officer at Novo Health Africa. Her vision is to be part of a new Africa where healthcare is accessible, affordable, and of high quality, irrespective of one's socio-economic status. So I'll be welcoming Dr. Obehi. Good morning, Dr. Obehi. So good to have you with us. The floor is yours. Welcome, welcome, welcome.
Thank you very much. Good morning to everyone on this platform today. I'm excited to be here, and I hope that we have a wonderful session. I'll just wait for my slides to be shared so that we can start. Okay. So good morning, everyone, and welcome to this session about the female reproductive health. Like she mentioned earlier, I am Dr. Obehi, and I'm going to anchor the session. So first of all, I'd like to say Happy International Women's Day to all the beautiful women here. And I hope that this session is a very informative session for all of us here. Next slide, please. So happy International Women's Day to everyone. Next slide. So the question is, why are we talking about the female reproductive health this time? It's because as women, we need to understand how our reproductive system works to help us make informed decisions about our bodies. And as we're all aware, our bodies go through different changes at different points in our lives, right from childbirth to menstruation, pregnancy, breastfeeding. Our hormones are all over the place, and it's important that we understand what changes occur so that we know the right steps to take, and we can make decisions about our bodies, decisions about if to have children, when to have children, or even how often to do so. And reproductive health is not really about the absence of any illness. It's just to ensure that we have a balance in our health, meaning that there are no problems at all. Everything is functioning properly. Next slide, please. Please, next slide. So the goal of this webinar is to help us improve our health right from menarche, which is usually our first menstruation, up until the end of menstruation, which is menopause. There are different things that occur in our bodies. Women are prone to fibroids, cervical cancer. Every month we have our menstrual period. Every month we ovulate. Women are prone to sexually transmitted infections. We need to understand family planning. So I'm going to try as much as possible to give us an understanding of these basic things, equip us with the knowledge we need to make informed decisions so that we can have healthier reproductive health. So first of all, the next slide, please. I'm going to talk about or help us understand the organs of our reproductive system. For most of us, we know that we have our uterus, which we typically call the womb. And at the site, we have the ovaries, which are structures that produce eggs and hormones. At the bottom of the womb, we have our cervix, and then we have the vagina. So many times I've heard people or I've heard women say that they're not aware that they have a different hole for urinating and a different outlet for their menstruation. So for us, it's important that we understand that where we urinate is completely different from where we have a vaginal blood from, which is menstruation, and then we have the anus. So for women, we have 3 organs. Apart from this, there are hormones that are produced in the brain or chemicals that are produced in the brain that help these organs function properly. Next slide, please. So we're going to start with menstruation. So like I mentioned earlier, we're going to talk about menstruation, vaginal discharge, family planning, pregnancy, cancers, fibroids, and menopause, and help us to get all the information that we need. So we're going to start with menstruation. For every woman in the reproductive age group, please next slide, we will go through menstruation, and menstruation is just the monthly flow of blood or the shedding of the womb. Next slide, please. And it occurs every month for every woman. On the average, every woman has a 28-day cycle, meaning that the interval between your first period, the interval between the date your first period starts and the next one is about 28 days. But we should also note that that is just an average. For some people, the interval might be 21 days, it can be 35 days. So as far as the interval between your periods every month falls between 21 and 35 days, we're good to go. Also, ovulation occurs once a month. In a woman who has a 28-day cycle, which is the average, she will ovulate on day 14, meaning that that is the period during which she can get pregnant. We're going to talk about menstrual hygiene because menstrual hygiene means that all women in the workplace or at home have access to menstrual products which help them absorb the menstrual blood and access to water, clean water, and soap when necessary. So we need to ask ourselves, how menstrual friendly is our workplace? There are different things that we can use. For most people, we're used to using sanitary towels, but we also have the options of tampons, menstrual cups. There are also options of reusable sanitary towels. So we need to understand the advantages and disadvantages of each product and use the one that works best for us. I've always heard people talk about premenstrual syndrome. First of all, premenstrual syndrome is just a combination of symptoms that occur just after ovulation and ends at the time a woman starts her period. They have things like bloating, they're irritable, they have headaches, they're depressed, they're tired. But the truth is most people actually will not have premenstrual syndrome. Most people would have symptoms that seem like premenstrual syndrome, but unless it affects your interpersonal relationship or your ability to function at work, it is not typically called premenstrual syndrome. Menstrual pain is the most common one, where a woman would have pain at the beginning of her period and usually ends about 2 to 3 days when her period starts. This is most of the time nothing to worry about because it is expected because of the chemicals that are produced during the process of menstruation. And this is usually managed with over-the-counter medications, so things like diclofenac, ibuprofen. Exercise also helps. Warm water, putting over your stomach, those things really help to relieve the menstrual pain. But at any point in time you notice that it's affecting your ability to function at work or your relationship with other people, you should see a doctor. Prior to this, I mentioned that it's possible to have an interval of 21 days. So if you see your period twice a month, you shouldn't really be worried because it is possible and it's common depending on the length of your period. Next slide, please. So vaginal discharge, I'm going to talk about this because I have seen so many patients present with vaginal discharge. And because people are not really aware of what normal vaginal discharge is and what abnormal is, they're not able to make decisions. Sometimes people walk to the pharmacy to buy medications because they have vaginal discharge. So vaginal discharge is normal. For most women, they would have clear discharge or whitish discharge or mucus on the days around their ovulation. So we shouldn't be worried most of the time. But the truth is, there are signs that would show you when you have an infection. So things like change in the color of discharge, so things like yellow discharge, greenish discharge, red would probably be menstruation. By the time you notice a foul smell, or if becoming recurrent, you should see the doctor. At this point in time, you shouldn't walk to a pharmacy or a chemist to just get any drug because there are certain drugs that are prescribed for certain infections. I've also heard people say that they take antibiotics to prevent sexually transmitted infections. And there is no study that has shown that taking antibiotics after having sex would help prevent sexually transmitted infections. No. You only take antibiotics if there is a diagnosis of sexually transmitted infection, which should be done in the hospital and not at a pharmacy or a chemist. So please, as women, we should understand what our normal vaginal discharge is so that when we notice anything that is off, we can seek help immediately. Next slide, please. So I'm talking about improving vaginal health because there are certain steps that we need to take that will help us reduce the occurrence or even prevent vaginal discharge. I'm sure that we've gone to so many stores and we would see scented feminine products that you should use to wash your vagina or your private parts. We typically do not advise the use of soap or feminine products. Water is enough to cleanse the vagina at any point in time. And this is because the vagina has normal bacteria that is meant to be there. By the time we wash with soap, disinfectants, we distort the normal anatomy. We distort what is meant to be the normal, and then we're prone to infections. And also, it's advised that you air your underwear in the sun because this helps to reduce bacterial growth and helps us to be healthy. Practice safe sex. For those who choose to use protection, please do. There's also information about people steaming or putting certain things in their private parts. This is really harmful and should be avoided at all costs. We should stop abuse of antibiotics. Yes, in Nigeria, while it is easy to walk to any store to get antibiotics, when we take antibiotics when it's unnecessary, we affect the normal anatomy of the body, and so we're prone to infections. And like I mentioned earlier, do not self-medicate. If you notice anything that is abnormal, please go to the doctor to seek help, and then you definitely be prescribed the right medication. Next slide, please. So I'm going to talk about infertility because this is very, very common. And contrary to what we believe, or most people believe, that infertility is a female problem. And this is typically promoted on our movies, and we see that, oh, in a family, the woman can't give birth, and then they bring another wife home to the man because they like it's the woman that has the issue, but the truth is, for most of the time, when a couple is not able to have a child or able to conceive after 1 year of adequate sexual intercourse. So adequate sexual intercourse is 3 to 5 times a week without protection. And if after 1 year of doing this, the family isn't able to have a child, they are termed infertile. But most of the time, 30% of infertile cases are caused by women, another 30% is caused by men, and 20% is caused by mixed causes, another 20% by unexplained causes. So the truth is, any couple who is unable to conceive, both the husband and the wife should seek help and should get tested to find out what exactly is causing the infertility. There are gender causes of infertility. So men have their causes, women have their causes. Pregnancy. As women, when we're in the reproductive age group, we will get pregnant at some point if we choose to. Pregnancy is normal. It is a physiological process. It's something that we all want to do. We want to birth our own children. But while it is important, it is known that in Africa or in Nigeria, women die during pregnancy. And this is because in Nigeria, we don't have a very healthy health-seeking behavior. Many of us would rather give birth at home or not even go to the hospital at all. But it's important that you have your antenatal care during the course of your pregnancy. Right from the beginning to the end. Every pregnancy is different. So what doesn't necessarily mean, so it's important that at every point in time you should be successful. There are medications that are given to a healthy child. So please ensure that you take all the medications that are prescribed. Also in Nigeria, we always hear that cesarean section is not normal delivery. I want to try vaginal delivery. Cesarean section is also a form of normal delivery and is indicated when vaginal delivery might be a problem. So if the doctor insists that you should have cesarean section, please ensure that you agree with him, because what is most important is that the mother and child are safe, irrespective of the method of delivery. So whether vaginal or cesarean section, as far as both mother and child are safe, please embrace the option given to you by the doctor. Next slide, please. So family planning is one of the things that women and men should embrace or should seek. So family planning is really just the way to space your children, to attain your desired number of children for whatever reasons, for financial reasons, for health conditions, whatever the reason is. So that's what family planning is. And we know of contraceptives. Contraceptives are just a type of family planning method. So we have the natural family planning method, which is when a woman is ovulating, they choose not to have sex during that period. So they don't use anything artificial. That is natural family planning method. We have contraceptives, which are artificial. So things like the pills that we take, their injections, the male condoms, female condoms, there are devices that can be inserted into the womb, there are patches. There are a wide variety of family planning or contraceptive methods. Different methods are more effective than the other, but the option is dependent on your need at that point in time. We have permanent and temporary family planning methods, so it depends on you. For a woman who has completed her family and feels that she wants to have 3 children, she can opt for the permanent family planning method. And what happens in that situation is that she is never going to be able to have a child. So if you and your husband decide that you want to have a family planning option, you should discuss with your healthcare provider to assess the advantages and disadvantages of all the options and then make an informed decision based on your condition at that point in time. So fibroids, I'm talking about fibroids because fibroids are really, really, really common. And in fact, there's a study that almost 80% of women will have fibroids at one time or the other in their life. But fibroids are benign, meaning that they are not cancers. They are abnormal, but they're not cancers. It means that we can live with them if there is no need to take them out. And most women who have fibroids will not have any symptom. In fact, they will not know that they have fibroids until after death, or maybe an ultrasound scan is done routinely and they find find a fibroid. For people who have symptoms, they have things like abdominal pain. So they have pain in their stomach, their menstruation is very heavy, or whatever symptom it is that they have. But there are no magic medications. I'm sure we've heard in the market, you hear these jingles, how you can take this drug and your fibroid is going to melt, or sexually transmitted infections are going to be cleared immediately. No, there is no magic medication for fibroids. If at any point in time the doctor feels that the fibroid is causing a problem, the option is surgery or certain medications that will help relieve your symptoms and not necessarily shrink the fibroids. So if at any point in time you're concerned about fibroids, please see a medical doctor. Never patronize the herbal concoctions that are advertised to shrink the fibroids, because they do not work. Rather, they cause more harm than good. Next slide, please. So I'm going to talk about cancers of the female reproductive system. As women, our organs, so the ovary, the uterus, and the cervix, are prone to cancers. But the most important one I'm going to talk about today is cervical cancer. And this is because it is the commonest reproductive female cancer. Now, we always hear about breast cancer, breast cancer, breast cancer. Breast cancer is the commonest cancer in women, but cervical cancer kills more than breast cancer. And this is because when most women are aware that they have cervical cancer, usually at the late stage when nothing can be done. Cervical cancer is preventable. It is vaccine preventable. It is one of the cancers that we know that if you take a vaccine for it or you get screened, your chances of having cervical cancer are reduced. And now cervical cancer is sexually transmitted. So what that means is a woman has to have sex before she can get cervical cancer. It is caused by a virus. Now, what it means is that if your partner has multiple sexual partners, you are at risk of cervical cancer. So as regards cervical cancer, both men and women are important in the transmission. There are certain things that increase our risk. So for example, age, the age at which you actually have your first sexual encounter, your partner, whether you're taking alcohol, whether you're smoking, and the general state of your health. Next slide, please. So every woman is at risk of cervical cancer. So your mother, your sister, your friend is at risk of cervical cancer. But the good thing is that it is preventable. So when you take the vaccine, for women who are between the ages of 9 and 26, we advise that they take the vaccine. And there are 3 shots that are meant to be taken. So the first shot to be taken 1 month after and 6 months after you take your 3 shots. For those who are already sexually active, we advise that they do a Pap Smear. And a Pap Smear is a screening test just done to identify certain changes that are occurring in the cervix so that treatment can begin as early as possible. So if you are sexually active, it's advised that you have a Pap Smear every 2 to 3 years. However, if you are less than 26 and are sexually active and you want to take the vaccine, you can get a screening done first, and then if you're fine, you can have the vaccine taken. We also encourage our boys and our men to get vaccinated because, like I mentioned, it is a sexually transmitted cancer. And so if your sons are vaccinated, it reduces the risk of transmission. And then we should practice safe sex. So we're going to talk about menopause. Menopause is the last phase in a woman's reproductive year. It is the end of her menstruation, where certain things occur and just let her know that, okay, at this point in time, I can't have children anymore. Menstruation stops, the hormones that are produced are reduced, sexual drive is reduced. A lot of things that occur, and it usually happens between the 40s and the 50s. So women would have hot flushes, so they're sweating a lot. They don't have any drive to have sex with their partners. Their vagina is dry. It is normal. It is very, very normal. And every woman at some point in her life is going to experience menopause. Next slide, please. So with everything I have mentioned about improving our reproductive health, there are general principles that we need to take, or general things we need to do as women, because the state of our health as humans or as women affect our reproductive system. So we need to ask ourselves, are we eating properly? are we eating? Do we have a healthy diet? How much fruits do we take? How much vegetables do we take, right? How much exercise do we even do? It is recommended that as adults, we're meant to have 30 minutes of exercise 5 times a week. So it means that we're meant to exercise for about 150 minutes every week. So we need to ask ourselves, are we doing this? We get that we're corporate women, we're in the workplace, but we need to find a way to incorporate this into our work. So what does this mean? You can choose to walk up the stairs instead of taking the elevator. If you're going to ask someone something upstairs, you can choose to walk instead of making a telephone call. These are ways to help us remain active. How much water do we take in a day? We need to take about 2 to 3 liters of water every day to be healthy. And this does not include drinks like Coke or Fanta. 2.5 to 3 liters of water daily. Practice safe sex. We usually recommend ABC. So abstinence, be faithful, and use protection if you need to. And keep your vagina healthy. Do not steam, do not insert anything into your vagina, air dry your underwear, stop abuse of antibiotics, only take medications that are prescribed by your doctor. And some people even choose to iron their underwear. That is also good because it prevents bacterial overgrowth. Understand your menstrual cycle. Every woman has a different menstrual cycle. The length of your period this month is not necessarily the length of your period next month. So it's nice to have a chart where you can understand the changes that occur. There are different apps that we can use. I'm sure everybody knows Flow. It is an app that we can download on our phone that helps us keep track of our menstrual period, helps us identify early changes that occur and when to know when to seek help. Also, understand your menstrual cycle helps you in case you want to have a child. You know at what point in time that you will be fertile, and also helps the doctor estimate your delivery date if you know your last menstrual cycle. Embrace antenatal care. Antenatal care is one of the most important decisions that we can make as women when we are pregnant. Please ensure that you go to the hospital when you're pregnant and visit your doctor at every point in time. Discuss family planning methods with your healthcare providers, with your partner, and make an informed decision based on all the information that is available to you. Avoid herbal concoctions. This is because they have not been proven to affect us or make us feel better. In fact, they worsen our conditions, affect our kidneys, because everything that we take in finds a way to the kidney, right? So if you take these herbal medications, they will affect your kidney at one point or the other. We cannot overemphasize the need to get vaccinated against human papillomavirus, which is getting vaccinated against cervical cancer. Every woman should please get vaccinated. And if you are above the age for vaccination and are sexually active, please ensure that you have a Pap Smear done every 2 to 3 years so that any change that is seen can be treated immediately. Seek age-appropriate sex education. Now, this also applies to our children, our female children, our male children. At different points in their lives, they're going to experience changes, right? Younger girls are at risk of unsafe sexual practices, abortion, and all sorts. So if they are not educated based on their age, so the truth is, for a child who is 5 or 6, they should get to understand their body based on their age. We need to give them the information that they need at that point in time. Also, for our male children, advise them about human papillomavirus vaccination and ensure that they also embrace safe sexual practices. Because as women, we will nurture children at some point in our lives. And without a satisfying reproductive system, we're not going to be able to enjoy our lives. And reproductive health is one of the most important things that we need as adults and as women. Thank you very much. And I will now take questions if there are any. Okay, so I'll take questions. I'm done with the first part of the presentation.
Hello. Hello, everyone. Thank you so much, Dr. Obehi. That was an amazing session. And we'll be diving into the question and answer session shortly. We have a few questions here that we are going to be taking. Someone is asking, what is your take on feminine spray? I know you spoke about how we don't need extra product for our vagina. So do you want to just elucidate that further? Basically, what's your take on feminine spray? Even if it's dermatologist recommended and tested, is it harmful? What's your take generally?
Well, for dermatological tested feminine spray, we usually advise against them because, like I mentioned earlier, our vagina just needs to be washed with water, honestly. We don't need to use any extra thing. I know some people want to have a nice scent in that area, but there's really no need for it, right? Using water alone is just sufficient. Using all these sprays, they have chemicals, they have things that would distort the normal flora, the normal bacteria that is meant to be in the vagina, and will put us at higher risk of certain infections. And so we typically advise against them generally.
Okay, thank you so much for that. Thank you so much for that answer. So can I add to that question? So when you say water, any type of water, warm water specifically, or room temperature water or cold water, please just give us more information in that area.
Well, there's no preference. It's usually what works for you. I mean, obviously, it shouldn't be steaming water, but warm water, cold water, depends on the temperature you're comfortable with when you're having a bath. That's just fine. But please, no hot water, except recommended by the doctor in certain conditions. But aside that, please stay away from steaming your vagina because it's not necessary.
All right, thank you. Thank you so much for that. Okay, another question here is it okay to use panty liners daily? Is it okay for a woman to use panty liners daily?
Yes, it's all right to use panty liners. So the truth is, as women, like I mentioned earlier, we would all have normal vaginal discharge at some point in the month at certain times. But during the mucus days, these are the days where we have more vaginal discharge. And people use panty liners because it prevents the discharge from staining their underwear, right? So it's all right to use panty liners because we have discharge. So panty liners just prevent the discharge from resting or being on the underwear. So yes, it's all right if that works for you. But we also advise against sleeping with underwear. It's advisable to just allow ourselves breathe at night. So yes, it's all right to use panty liners if it works for you.
Sorry, can I add to that question?
Yes, please.
So, we talk about how you shouldn't suffocate your vagina and all that. So, is there a particular type of panty liner you should be looking at using, or any type that works for you and doesn't have any effect, or you should be looking at a specific type, maybe cotton based or something?
I think it just depends on what works for you. They have different materials, right? So whichever you're comfortable with, whichever is soft, whichever doesn't cause any form of irritation or itching for you or have any side effects, any panty liner is actually good.
Okay, thank you so much. Someone is also asking, does Postinor-2 have any negative effect? I'm sure we've heard of Postinor-2.
Okay, so Postinor-2, for those who haven't heard, Postinor-2 is an emergency form of contraceptive. So what people that take Postinor-2 usually take it after a sexual encounter or sexual intercourse, and they're afraid of getting pregnant. It's an emergency, and it can only be taken within 72 hours of sex. So if you take it after 72 hours, it's not going to do anything. And just like every drug, it has side effects, right? Every drug has side effects. Postinor has a side effect. It is not 100% effective. So there's no assurance that if you take Postinor-2 today after having sex, you're not going to have a child. Yes, it is over 90% effective, but it is not 100% effective. So we would rather recommend more long-term contraceptives instead of the emergency contraceptives, because by the time you notice you're taking emergency contraceptives, it means that you don't even have a healthy reproductive life. So you're taking high risk. So rather than sticking to emergency contraceptives, it's better to stick to a long-term form of contraceptive instead. But yes, every drug has side effects. So Postinor-2 has its own side effects.
Thank you for that response. Please, could you mention some of the effects so that everyone is clear on that of Postinor-2?
Okay, so like with every hormonal contraceptive, so Persona 2 is a drug that has hormones in it. And what hormonal contraceptives do generally is that they might affect your menstruation. So for example, a woman who knows that she bleeds every 28 days, by the time you start taking hormonal contraceptives, you might notice that your period is scattered. You don't even know when your next period is going to be. It might be in 2 months, it might be in 3 months. So it becomes hard to track your period. For some people, they feel like it helps them, it makes them gain some weight. Also, generally, hormonal contraceptives increase the risk of certain form of cancers, right? So different side effects, headaches, you just feel generally unwell. So for some people who use hormonal contraceptives, it might be hard to know when they're sick, or it's usually just side effects of the contraceptive. So bloating, headaches, disturbance in your menstrual cycle, bleeding in between your menstrual cycle. But these do not happen to everyone. It also depends on if you're taking the right dose that was prescribed for you by your doctor. So yeah. So those are the common side effects.
Thank you so much for that answer. Very, very clear. Okay, there's a question here saying, does the same vaginal rule apply to the anus? So basically, you've advised us not to use soap in the vagina, but is it okay to use soap around the anus?
Well, I would typically say yes, but it's very hard to delineate to know demarcation. So if you're sure that you know where your anus stops, fine, why not? But you have to also be careful. You shouldn't insert the soap into your anus, of course not. You should wash the surroundings, but yes, that is recommended.
Thank you so much, Doc, for that response. Very, very clear. So I'm going to be asking a few questions. I'll just lump them together about cervical cancer. So someone is asking, are you still at risk of contracting cervical cancer if you do not have multiple partners, but can't say the same for your partner? Of course. Secondly, are there other causes of cervical cancer outside sexual transmission? What do you have to say to this question, Doc?
Okay, so like I mentioned earlier, cervical cancer is a sexually transmitted cancer. So what that means is you necessarily or you need to have sex to get cervical cancer. Now, like you said, you can only speak for yourself. So if you have one sexual partner and your partner has human papillomavirus, yes, you can get cervical cancer. If your partner has multiple sexual partners, it means that he is at risk of getting infected with the virus and can't transmit it to you. So you can only speak for yourself and hope that your partner stays faithful and doesn't have multiple sexual partners. And like I said, boys and men should get vaccinated too. So if they're vaccinated, then the risk is reduced. But most importantly is that you stay faithful and encourage your husband or pray or hope that he stays faithful too. Because when men have the virus, they will not come down with cervical cancer. They can come down with other forms of cancer, but not cervical cancer. So that's why they also need to get vaccinated. Now, there is no other way right now that we know that cervical cancer is transmitted except sexually. So that is the cause, but there are other risk factors. So what that means is that it's not everybody who gets infected with the virus that will get cervical cancer. So there are other risk factors. So things like if there is someone else in your family who has cervical cancer, say your mom, your sister, you are at higher risk. If you do not have a healthy lifestyle, so are we taking a lot of alcohol, smoking, things that generally will reduce our ability to fight infections, then we're at higher risk of getting cervical cancer. People that have HIV and certain other conditions that will reduce our ability to fight infections, they're at risk of cervical cancer. But for now, as much as we know, it is caused by the virus that is transmitted sexually. So, but there are other things that make people at higher risk having cervical cancer.
Thank you so much. Thank you so much, Doctor, for those responses. I feel like you've answered the question so well. Thank you very much. Still on cervical cancer, we're going to be taking questions now on vaccination. All right, someone is asking what age is right for cervical cancer vaccination. I know that in your slides there was something about age 9 to 26, right? But I think this person requires more clarity. I also require more clarity. Does it mean that from a 9-year-old can take the vaccine, and once you're 26 and above, you can't take the vaccine anymore, or how does it work? Then secondly, someone says, I started taking the vaccine for cervical cancer, but I took 2 shots and wasn't able to take the last shot. What does this mean for me? I'm currently 27. So please provide responses to this question.
Okay, so for studies that have been done, it's been shown that the vaccine is more effective in women aged or girls aged 9 to 26. If you are more than 26, you can take the vaccine. Just know that it is not as effective as it would be in someone who is less than 26. And that is because it is a general knowledge, or it's what most people feel, that at 26, most women will probably be married or be sexually active. So at that point in time, what we recommend is Pap Smear. But if you're over 26 and are not sexually active and you want to take the vaccine, that is also fine, but it is not going to be as effective as someone who is less than 26 years. And for the person who took the 2 shots of vaccine and hasn't taken the 3rd one and is 27, the reason why certain vaccines require 3 shots is because the level of protection is more dependent on how many doses you have taken. So for example, the human papillomavirus vaccine, for someone who has taken 1 shot, the person may have like 20% protection, but someone who has taken the 3 shots will have like 97% protection. So the more shots you take, the higher your protection. If you've taken 2 shots and haven't taken the last shot, it depends on when you took the last shot, because the interval between the 2nd shot and the 3rd shot should be about 6 months. If it's more than a year, your doctor may recommend that you start all over again, but this should be done in the hospital. And even if you're 27, like I said, it's not that it is an outright rule that you cannot take the vaccine. It's just that it is less effective. But since you started, it's advised that you please complete your vaccine, or if need be, start all over again.
All right, thank you so much, Doc. Thank you so much for that clarification. Very, very detailed. Okay, so we have a lot of questions. We'll be taking questions on ovulation and menopause. So someone is asking, please, talking about menopause, what are hot flushes? I think this should be flushes. What are hot flushes? I don't know. Do you want to answer that before I take the questions on ovulation?
Let me just answer that. So hot flushes is just necessary. How do I explain? Like, you're literally just hot. Like, that's just what it is. You're sweating a lot. The fan may be on. You're in front of the AC that is at 16 degrees and you're sweating a lot. You're irritable. So you're just constantly holding the fan. So it's just necessarily that you're sweating, you're hot, you're uncomfortable. So that is just what hot flushes are. And it's typical with women who are approaching menopause.
Thank you so much. Thank you so much for that answer. So going to questions on ovulation, someone is asking, I go through a lot of pain during my ovulation. I do not understand this. Should I see a doctor? And someone says, how do I know if I am really ovulating? And thirdly, someone says, you mentioned that the ovulation period for 28 days menstrual cycle is 14 days after menstruation. So I'm thinking, is that 14 days or on the 14th day of the cycle? So the person requires clarification on that part. And then there's also a question about what is ovulation period for a 24 days menstrual cycle, please? We have a lot of questions. Should I take all of them at once, or you want to start answering?
Let me start answering them so that I do not forget any of the questions.
Okay.
So I'll start with the one that asked about when is ovulation period for someone who has a 24-day cycle. So I'll just talk a bit about ovulation, or the menstrual cycle, all over again. So the menstrual cycle, day 1 of the menstrual cycle is actually the day your period starts, not the day ends. So let's use February, for example. February is the perfect month. It has 28 days. If a woman sees her period on February 1st, February 1st is the first day of her menstrual cycle. If she has a 28-day cycle, on Valentine's Day, February 14th, she is going to ovulate. That is because she has a 28-day cycle. Now, the menstrual cycle is divided into 2. The first part before ovulation and the second part after ovulation. The part after ovulation for most women is always 14 days. So what that means is that your ovulation is always the length of your period minus 14. So for the person who has a 24-day cycle, it means that she would ovulate on day 10 because the other half of the cycle is always 14 days. So if you have a 24-day cycle, you ovulate around day 10. If you have a 35-day cycle, you would ovulate around day 20 or day 21. So the second half after ovulation is always constant and is set at 14 days. Now, ovulation pain happens. So that's where you typically hear women that we don't even get any breaks, right? You're on your period, you're having pains. You're ovulating, you're having pains. After your ovulation, you're having pains. So people have pains during ovulation, but it varies. You shouldn't really be concerned except the pain is unbearable and it's affecting your ability to function at work. And if it does, please, you should see a doctor. For most people, they will have some pain during the ovulation, which goes down in about 1 or 2 days. You would also know you're ovulating because you might feel unwell. And this is because there are certain hormones that are increased around ovulation. So women will feel unwell. They might have a fever, which is not high grade. So your body just feels a little hotter than normal. And this is normal because of the hormones that are produced around ovulation. There was another question I think I missed.
Someone says, how do I know I'm really ovulating?
Okay, so like I mentioned earlier, sometimes it might be hard to know, that's the truth, because there's something called anovulatory cycles, meaning that the woman is actually bleeding, but she's not ovulating. So for most people, they usually identify this problem when they're trying to give birth or they're trying to get pregnant. But for most women, they will ovulate. If you notice that you're having your mucus days, you have a fever, your breasts are tender, you feel unwell around the middle of your cycle, for the most part, you are ovulating. If your period is also regular, most of the time you're actually ovulating.
Thank you so much for those answers. So still on ovulation questions, we have a lot. Someone says, thank you so much, Ma. For one who isn't sure about her ovulation and wants a natural means or not artificial means or family planning, what is the best advice you can give to get good spacing for children?
For someone who doesn't, so I mentioned that we need to understand our menstrual cycle. The truth is, understanding your menstrual cycle is one of the most important things that you can do because it helps you plan pregnancy. It helps you quickly fish out certain things that have changed in your body. So you can get a book. If you do not want to use an app on your phone, you can get a book and you track your period every month. So you write the date. February 14th, my period started. And then you note the next month. So you notice that at the middle of your period, depending on the length, you know when you're ovulating. And if you want to explore the natural family planning method, so what that means is around the time when you're ovulating. So for example, a woman who has a 28-day cycle and is ovulating on day 14, her fertile period will be around day 12 to day 15, which is 2 days before ovulation and about 1 day after ovulation. So that is going to be the period when you would avoid sexual intercourse with your partner. So you need to understand your menstrual cycle first to be able to effectively use the natural family planning method. So without an understanding of your menstrual cycle, it is almost impossible to use the natural family planning method.
Thank you. Thank you so much, doctor. Okay, still on that, someone is saying, when is a lady active to get pregnant? Is it before or after her ovulation? As I heard, it's possible before ovulation. So based on what you've explained, is it possible for a woman to get pregnant?
Yes, it's possible for a woman to. So what happens is this sperm can survive in the vagina for a couple of days. So what that means is before ovulation really means the release of an egg, right? So before ovulation, so a woman who ovulates on day 14, on day 12 or day 13, if she has sex with her partner, the sperm would float and survive around there. And then on day 14, when the egg is released, the sperm would mate or meet the egg. So it's possible to get pregnant around your ovulation, peri-ovulation. So it's called your fertile period, which is typically 2 days before you ovulate and 1 day after your ovulation. That is your fertile period, and that is the time where you're most likely to get pregnant.
Thank you, doctor. That really clarifies that question. We have a lot more questions. Can I continue?
Yeah,
Someone is asking about fibroids. So someone wants to know what exactly are the causes of fibroid. You mentioned that a lot of women will have it, and some of us we won't even know until we have to do a test or we have to go to the hospital for a scan. So what are the causes of fibroid? And then someone is asking what is the difference between fibroid and cyst, because I know some women deal with cysts in their body, ovarian cysts and the rest. Is there a difference between that and fibroid? These are the two questions we have on fibroid.
Okay, so causes of fibroids. There's no one cause of fibroids. So like the way we say malaria is caused by the bite of a mosquito, there is no one cause of fibroid. Every woman is at risk of fibroids, but there are certain things that will increase your risk of fibroids. So fibroids are just the growth of the tissue in your womb. So things that increase your risk, for example, a family history of fibroid, right? Being a woman is a risk factor. So unless you're male, you're most likely going to have a fibroid, right? And women who are overweight or obese at higher risk of fibroids. And being Black also puts you at risk of fibroids. So there's no one known cause, but being female on its own just puts you at risk of fibroids. And certain hormones in the body also help you, also encourage the growth of fibroids. So what that means is, in a woman who is exposed to a lot of hormones, she most likely will have fibroids. You will notice that women who have many children, who have like 12, 6 children, who are always pregnant, there is no room for growth of the fibroid. It's like vacuum. If there's a space, the fibroid will grow. So the truth is, once there's nothing occupying your womb, the fibroid is definitely going to grow. So yes, everyone is at risk of fibroids. Then the difference between fibroids and cysts. So cyst is a collection of fluid. Fibroid is like tissue, like muscle that just overgrows. Cyst can occur in any part of your body. So you can have cyst on your skin. You can have cyst on your ovaries. Cyst is just a collection of fluid, but it is an abnormal growth, and they have different means of treatment. For ovarian cyst, unless it is causing severe symptoms, most of the time, you can choose to leave it. It's a very small cyst, nothing to worry about. But if the doctor recommends surgery or certain medications, please embrace the option. But cysts and fibroids are different. Fibroids occur within or around the womb. Cysts can occur in any part of the body, and it's just a collection of fluid.
Thank you so much. That really clarifies it for us. And I just, because this is a session on health, the questions are so much, and I'll be diving into one more for fibroid. And someone says, what is the risk of having fibroid surgery? Is there any risk associated with, having a fibroid surgery where you remove it, especially when it's so big? What do you have to say about that?
So every surgery, every decision that we make has its risk, right? But for the most part, fibroid surgery is a relatively safe procedure, depending on where you do it and who does it, right? So if you're going to have a fibroid surgery, you should let it be done by a specialist. It's not going to be done by a roadside auxiliary. It has to be done in the hospital by a professional, and so the risk is reduced. It's a relatively safe procedure. It's fast and dependent on the site, but like every surgery or every decision, there are risks that are involved, which are definitely going to be explained to you before surgery if the need arises. But if it has to be taken out because of the symptoms, please ensure that you opt for that decision.
Okay. Thank you so much, Doc. Thank you so much, Dr. Obehi. We have much more questions. I hope it's okay to go ahead with these questions. Okay, so someone is asking, we have a number of questions about contraceptives and birth control pills. So let me see if I can just batch them together. Is that okay?
That's fine.
So someone is asking, given that feminine, okay, please, is it true that some birth control pills help to reduce or stop serious menstrual pain? We also have, and then we have, is it okay to use the IUD that makes you not see period for long periods of time?
Contraceptives are medications that are hormone based. So it means that apart from preventing pregnancy or preventing childbirth, they do other things in the body. So like that person actually said, it can help with your period. But in that situation, it is not given as a form of contraceptive. It's given to relieve the symptom that you have in your period. But you shouldn't just walk to a pharmacy to get that medication, right? Because the medication that is prescribed is dependent on the symptoms that you have or the diagnosis that was made. So yes, you should see a doctor if you're worried about your period, and they will prescribe the right medications for you. As regards IUD, intrauterine device, it's a form of contraceptive. It's all right to use if that is what you so desire, after the advantages and disadvantages have been explained to you. Yes, it's long term. It's not something you have to take in and out every other week. It can be there for years, but you should also discuss all the available options so that you can make an informed decision. I cannot talk extensively about contraceptive here because there's so much information available, but always discuss all the options with your partner and with your healthcare provider so that you can make an informed decision on the contraceptive that you want to use.
Thank you so much. Thank you so much. Okay, so someone is asking, we have questions regarding the vagina again. Someone says, I always see pant liners inside sanitary pads. I don't know how to use them. Please, how can I use them? Explain. I think we just wear that as a regular pad.
Yeah.
And then someone says, given that feminine sprays and soaps are discouraged, do you encourage the use of supplements such as cranberries as a measure towards maintaining a healthy vagina area? I think it's rather better to eat the cranberries instead of taking them as supplements, but let's hear from you, Doc.
Okay, so typically supplements are things that we take because we want to supplement something. We want to add what we're not getting enough from our meals. But the truth is, if we're able to eat healthy, take enough fluid, take enough fruits and vegetables, there might be no need to take supplements unless prescribed for certain conditions. Yes, there are studies that have been shown that cranberry helps to reduce urinary tract infections. Yes, but how well does it do that? So by the time you have a generally healthy lifestyle, your risk of infection is actually reduced. So let's stick with focusing on improving our our lifestyle, rather than sticking to supplements or vitamins or medications or multivitamins. Most of the time we don't need them. We get enough of those from our diet. So let's stick to that instead of taking in a lot of medications and drugs.
I agree. Thank you so much, Doctor. So we'll be moving to questions about sex. Someone is asking what causes STDs. I believe STDs are sexually transmitted diseases, and most times we get them from having sex, right? But this person is asking what are the major causes. We also have a question about, a person says, I don't get sexual satisfaction through penetration. What's the cause and solution to this, as it is really worrisome? We also have a question about if anal sex is good for a woman. What are the challenges or what damage can it cause? And someone asking, I think it's a different question. So let's take the one on sex and then we can take this one.
So the question about anal sex, I mean, that's somebody is probably just trying to explore. I mean, the normal thing that we know, or the way our bodies function, physiological thing is to have vaginal sex, not anal sex. But if you choose to explore, that is not discussion for this platform, but the normal thing is to have vaginal sex. Someone asked about sexual satisfaction. For that situation, you should see a doctor with your partner to understand what is causing the sexual dissatisfaction, or discuss with your partner to find a way around it. There's no one treatment for that. Every situation is different. So you need to understand what is causing the dissatisfaction, if it's a hormonal thing, if it's how you feel, if that you're angry, whatever it is, discuss with your partner. And if there's still no solution, please see a healthcare provider for that. There was another question about sex. Sorry, I don't remember what that question was. I think I missed it.
It was about STDs. What causes STDs?
Okay, so sexually transmitted diseases are infections that are transmitted sexually. So if you have a partner who has an infection caused by a bacteria or a parasite, whatever it is, they're most likely to transmit it to you, or you transmitting it to your partner after sex. So it is a sexually transmitted infection. There's so many, like there's a very long list of sexually transmitted infection. And that's why I mentioned that it is not all right to walk into a store to get medication, because every disease has its own modality of treatment. Because person A has this sexually transmitted infection doesn't necessarily mean that that is the same infection that person B has. So with every infection that you have, you should go to the hospital. And in sexually transmitted infection, your partner has to be treated. It's not a one-person treatment. So you need to know who you're having sex with, so that in case you get infected, your partner can also get treated, and your partners can also get treated if the need arises.
Okay, thank you, doctor. Very, very on point advice. Okay, so someone is commending us. This is a good initiative. Thumbs up to Heritage Bank. Please, I would like to know the chances of getting pregnant even after an artificial birth control has been done. So like, for instance, a person uses an implant. What are the chances of getting pregnant?
Every contraceptive or family planning method, there's no family planning method that is 100% protective, right? But they give a very great deal of protection. So as with everything, it can fail. If, for example, you have an IUD in place and it has changed location, because it's possible for it to shift. If it shifts, then you can get pregnant. If you're taking the pills and you skip the pills, you can get pregnant. So what matters is not enough to know that you have this implants or the IUDs. Are you checking regularly? Have you changed it as prescribed? So there's certain contraceptives that need to be changed every 5 years or every 3 years. If you leave it longer than that, then you can get pregnant, right? But the truth is, there is no one contraceptive that is 100% foolproof. They give a very great deal of protection, but it is still possible if they fail and if you do not adhere to the prescriptions as recommended by the doctor.
Okay, thank you, doctor. There are more questions and I will just try and lump them together. Basically, we have general questions about a woman's reproductive health and then your advice. So someone is asking, most doctors say we shouldn't wear nylon underwear, but sometimes the seamless ones come as nylon and latex and all that. So what do you think about this? What's your take on it? Added to that is someone asking, is it actually detrimental for women to eat certain foods? Does it affect their reproductive health? Foods like meat, milk, cheese at certain ages, is it detrimental for a woman to eat certain type of food? Does it affect her reproductive health? And then someone is asking, as a female bank worker, which method of family planning is good for women? I know you've recommended a lot. Maybe this person just wants a specific recommendation, especially because as bankers, our work is very tasking and all. And lastly, someone says, is there any disadvantage of not changing a preventive coil that is valid for 10 years before the validity? I hope I haven't swamped you with too many questions.
I'll just try to I'll take them. For the underwear, we typically recommend cotton underwear because they're breathable. So what that means is that it is not adhering tightly to your vagina or your perineum. So air can typically get in. It prevents buildup of moisture. So it just helps prevent infection. That is why the doctor will typically recommend cotton underwear rather than nylon or silk or whatever options that are available. And for diet, there's not one diet. The truth is, as much as we're trying to improve our reproductive health, if we're not healthy generally, our reproductive health is not going to be at par. So what we need to do is to ensure that we're healthy. There is no diet that puts you at risk of certain things. Although there are things we should avoid. For example, I've been saying alcohol, smoking, cholesterol-based food, processed food. All of those things are not very healthy for us, right? So we need to ensure that we have a healthy diet, not necessarily because of our reproductive health, but because of our health generally. For IUDs, if it was prescribed for 5 years, please, once it is 5 years, please go to the hospital to get it taken out so that we do not have complications or whatever it is. So if it was prescribed for 5 years, please do not leave it for 10 years or 15 years. Please go to the hospital. I'm not going to be able to prescribe a contraceptive for a banker. Everybody's need is different. So you should discuss with your healthcare provider to get all the options and pick the one that is suitable for you. So you should do that.
Okay, so I'll just take you back a bit. So the question about the IUD. So if it's prescribed for 5 years or 10 years now, should you take it out before that 10 years? Is that okay? Or you have to wait till the 10 years?
It depends on you. Because IUD is not a permanent form of family planning, it means that if at any point in time you choose that you want to have a child now, you can take it out and have a child. So if you're prescribed for 10 years and you and your partner have decided that, you know what, we've tried, I feel like having a child now, you can get to the hospital and have it taken out and then you can get pregnant. But if you want to wait for the 10 years, that's also fine. You wait for the 10 years it was prescribed for and then take it out after the 10 years. It depends on you. So because they're temporary and reversible, you can always change your mind at any point in time, as opposed to the permanent ones where, for example, you tie your tubes. That is permanent. It's permanent. It's permanent. There is no going back. So that's why most people would recommend the temporary ones in case you change your mind rather than the permanent ones.
Okay, thank you so much, Doc. We have questions again on cervical cancer. I'll just try to take this as one. Someone is asking, does it mean that 3 shots of cervical cancer vaccine is for the lifespan? I'm thinking this question is for life. Like 3 shots of cervical vaccine is for life. And how do men get infected with the papillomavirus you talked about? And what are the symptoms of cervical cancer?
Okay, so I'll start with the symptoms of cervical cancer. So typically people have things like foul smelling discharge. They may have swelling in their legs. Also depends on, well, the extent, how far it has spread. But the most common thing is for a woman who has reached menopause, she notices that she's bleeding. Because at menopause, you shouldn't menstruate anymore. So if at menopause, you notice that you're having bleeding from your vagina or a foul smelling discharge, that's usually the first marker for cervical cancer. If you notice anything abnormal, please always see a doctor. But the commonest thing is foul smelling discharge or bleeding in a woman who has reached menopause. For now, it is recommended that just 3 shots are sufficient. If sometime in the future that changes, I'm sure we would all know that. But for now, 3 shots are sufficient shots for the protection against human papillomavirus. So there are different strains of human papillomavirus. There are different ways it can be spread, but most commonly it is transmitted sexually. So if a man has sex with a woman who has the virus, he can get it. So it's usually transmitted from person to person, just like sexually transmitted diseases or infections. So that's how it's transmitted. But there are different strains. Now, it's not everybody who has the human papillomavirus infection that will have a cancer, right? So there are different types. So, and they're typically numbers. So there's a number that causes the cancer. So for example, number 18, that's human papillomavirus 18 will cause a cancer. But human papillomavirus 3, for example, will not cause a cancer. So it depends on the strain that the person is infected with.
Thank you so much. Thank you so much for the answers you've given to all these questions. Thank you, Doctor, for the presentation and taking out your time to answer all these questions that we've had. There are many more questions that are coming in, but I think we need to wrap this up at this time. and you provided responses to most of these questions in your presentation. So I'll just say to the other questions have been asked. People are still asking, should we sleep with panties? Should we wash our vagina with soap? And the doc has answered most of those questions. No, you shouldn't wash your vagina with soap. No, you shouldn't sleep with panties. So what we would do is, for this session with the doctor and all the questions she has answered, it will be up on our YouTube page, Heritage Bank PLC. So you can just go to our channel at Heritage Bank PLC on YouTube, and then you would see the presentation and this session. Thank you so much, Dr. Obehi. Do you have any final words for us before we wrap this up?
Thank you very much for having me, and I hope that we've all learned a lot from this and we take all the necessary steps to improve our reproductive health.
All right. Thank you so much. It was an amazing session with you. I learned so much, and I intend to apply a lot, as I hope that others will be able to apply. So guys, everyone, thank you for joining us today. I'm sure you got as much value as I did. I learned so much, and I hope you did too. Please join us tomorrow at the same time, 9 a.m. and we'll be having another session with an amazing speaker. And you can catch our day 1 to day 3 so far on our YouTube channel, like I said earlier, Heritage Bank PLC. And please ensure you don't miss day 5, which is on Friday. It will be the final, and it's going to be an amazing session. Thank you so much for your time and joining us today. I hope you've gotten value. Have a wonderful rest of the day. Bye.
Bye. Okay.